Hello, everyone. I'm Kibin Alleyne, and today is Tuesday, February 20th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. In February, healthcare professionals emphasize cardiovascular health and promote awareness through American Heart Month. Section head for clinical cardiology at Montefiore Health System, Dr. Leandro Slipczuk Bustamante, shares some effective ways to enhance your heart health and reduce the risk of heart disease. Doctor, thank you so much for joining me.
Thank you very much for having me. My pleasure.
Now, what are some factors that result in heart disease being the leading cause of death for so many Americans?
Yeah, for sure. So it's a pleasure to be here, in this Heart Month, helping patients and viewers to understand the risk factors for coronary heart disease. So some of the major ones are high blood pressure or hypertension, diabetes or high blood sugar, high cholesterol. And the important thing of these risk factors is that usually you don't feel them. So it's very important that you see your doctor so they can measure in your blood your levels that they may be putting you at risk without you realizing for it. Then some other ones are obesity, we have smoking, we have lack of physical activity, and we have some specific for women, for example, like early menopause, or we have polycystic ovarian syndrome. So I think it's very important that you don't wait for symptoms, that you seek for a cardiologist or your PCP to just measure all these risk factors so we can do effective prevention.
Now, you mentioned women, so I'm curious to know, like, if you could expand on that a little bit more, and maybe mention some other demographics or communities that are high-risk patients.
Yes, for sure. So in particular, women are at risk as for a long time we have not thought about women as being at risk, and we tended to think about the middle-aged or older men as having heart attacks. But we know that that's not true. So women are at risk. They have different risk factors. They may be more affected by risk factors like hypertension, and they may be less likely to be treated for these risk factors like high cholesterol, hypertension. And we know we have data that when women show up to the emergency room or they show up, to doctors, they tend to we tend to recognize less the symptoms from a heart attack. So that puts them in particular risk, and in particular makes it more important to do prevention and not wait for the symptoms that sometimes can be different in women. Some other groups are at high risk. Well, we have people with very high cholesterol, those with severe hypercholesterolemia or familiar hypercholesterolemia. We have patients with diabetes that are at high risk. And we also have people in minorities. We know that patients that self-identify as non-Hispanic Black or Hispanic tend to have more obesity, for example, and tend to be more prone to high blood pressure. So it's very important that if you belong to any of these groups, you check yourself, you check with your doctor. So we recognize these risk factors that are easier to treat early on, but a lot harder to treat once you had a heart attack.
Thank you so much for, kind of sharing some information on that. Now, I'm curious to know, how is this affecting Gen Z and younger generations? I know that a lot more young people nowadays are kind of, worried about their health and, the way that they're eating. So, have you noticed that Gen Z and younger generations been affected by this at all?
Yeah, that's a very good question. And we are tending to see, heart disease in younger patients. And we're doing at Monty, research to understand this disease that is starting to affect earlier and earlier ages. So part of that is related to some risk factors like obesity. Obesity is an epidemic, and we're seeing, younger patients being affected by obesity, even toddlers that have higher incidence now. So that in one side, on the other side, the decrease of prevention, and we still are emphasizing too much at the early stages of life in recovery from once we had a heart attack, which are very important things, but as well we should shift all the interest to prevention, or without letting the other slip, but focus on prevention, because if we treat in the preventive side, it's a lot easier to prevent a heart attack. We know how to treat high cholesterol, we know how to treat blood pressure. They're not hard to treat. The problem is, how do we reach patients to make sure they are aware that they are being treated appropriately, and in that way we prevent the first heart attack from happening.
Now, I know you mentioned not to wait till you have symptoms to kind of get your health in order, but what are some symptoms commonly found in most heart diseases?
Sure. So we want to treat early, but once you have the symptoms, it's very important that you identify those early on so you don't wait having symptoms for a long time. And this affects me personally. I remember my grandmother in Argentina, where I'm from, had a heart attack, and she was a smoker, and she waited at home for over a day with symptoms of heart attack without telling anyone. And by the time that she went to the hospital, it was unfortunately too late. So if you start having symptoms such as chest pain, chest pressure that goes to your jaw or to your arms, sometimes may go to the back, that starts all of a sudden, you may feel short of breath, things that you were commonly doing are now very hard to do. In these circumstances, you should reach out to your doctor, and if you cannot reach your doctor, you should go to the emergency department. So once you start having these symptoms that are different than what you usually feel, don't stay at home just waiting. Very important that you see a medical provider.
Now, heart disease is preventable, which is the most important thing that we want to share with people. But, what can people who currently have issues with heart health do to live healthier lives?
So we talked about the risk factors that have to be measured, but we also talked about obesity and how important it is to stay in a healthy weight, uh, how important it is not to smoke. And one thing that we didn't talk yet is how important it is to stay physically active. We know if you do at least 7,000 or 8,000 steps a day, and if you do at least 150 minutes of moderate to high intensity exercise per week, these things are very important and decrease mortality overall. It decreases it for people that have a coronary heart disease, for people that still don't have any disease that is expressed. So we can do a lot with the way we eat, with the way we exercise, and the way we control our risk factors in order to prevent heart disease from forming.
Now, something I really want to highlight, which I found very interesting, is that oftentimes to make healthier choices, people will opt for alternatives like diet soda. However, we learned that it actually can contribute to heart health problems. Can you tell us a little bit more about that?
Sure. So it's very, it's hard sometimes, and you may be living in cities like New York City that we would think that everything is next to you, but in certain areas in particular, it's hard to reach healthy foods. But it's very important to find the ways where you can reach these and try to avoid, in particular, ultra processed foods. So that's the particular issue with conservatives, the particular issues with uh, with sugar, added sugar, that we should try to avoid. So I think in general, what I tell patients is try to eat more fruits, try to eat more vegetables. If you want to take a plant-based diet, that's okay. Mediterranean diet is also okay. And but try to, whatever you do, stay away of ultra processed foods. If you try to eat, plant-based diet, but you switch into an ultra processed plant-based, that's not going to help you. So try to eat more natural fruits, vegetables, and if you choose to eat meats, try to stay more in the fish, more in the Mediterranean kind of diet.
Now, with the advancement of technology, I'm curious to know, are there any new treatments or services to assist those with heart health challenges?
Yes, we've made a lot of progress. I think in particular, I do imaging and I do prevention with, I have a lipid clinic and a preventive clinic, and things have changed a lot. So we have a lot of different tools now to diagnose heart disease and a lot of different tools to treat risk factors such as high cholesterol. Before, we invented a medication called statins that, cardiologists invented over time. But now we have a lot of different tools that can be tailored to each patient needs. So we have the tools out there to treat most of people. And the thing is that we need to see them, we need to have patients come back, and we need to raise awareness of the importance of treating these risk factors. One factor for diagnosing heart disease that I want to emphasize are coronary calcium scores. So, with a coronary calcium score, you may detect plaque forming in the arteries on your heart before you have symptoms. And once we detect that, we can treat more aggressively. And in this way, we can aim to decrease the risk of having a heart attack by knowing that slowly you're forming plaque. And this can happen without you realizing, without you having symptoms, and sometimes even without you having the typical risk factors for coronary heart disease.
Now, can you quickly just let us know what are some ways Montefiore promotes heart health in the Bronx? And that could be, from anything from education to screening opportunities. Can you just let us know what Montefiore is doing right now to kind of prioritize heart health in the BX?
Yeah, for sure. So we have multiple different measures for this. We have a wellness clinic, we have a preventive clinic where people can come to us just for a checkup. And we have a different, group of cardiologists with many of them emphasizing in imaging and in treatment of cholesterol, treatment of diabetes. We have our wellness clinic with Dr. Rob Osfeld as well, with an emphasis on plant-based diets if you're interested in that. And in particular, also where we have a lot of new initiatives in order to identify patients that are at the highest risk, like those patients with severe hypercholesterolemia, patients with severe markers such as high lipoprotein A. And we're trying to identify these patients in our network. And once we identify them, try to reach to them to try to provide an alert that they are at high risk and try to provide suitable venues to decrease that risk.
All right, Doctor, I want to thank you so much for joining us and kind of spreading the awareness for American Heart Month and, just educating our community. So thank you so much.
Thank you very much.
To keep up with all the work that Montefiore does, please go to their website at www.montefiore.org. Don't go away. We'll be back with more Open after this.